It's time to begin the webinar for fibroids. I have three wonderful panelists with us tonight. I've got, going from the other end, Juliet.
Hi.
And Carrie in the middle.
Hello.
And Patsy is right here next to me. And we'll hear different stories about how these ladies came to get fibroid embolization. Let me also mention a little bit about this evening. This is the first time for quite a while we've all been in the same place. I'm used to seeing everybody on their Skype cameras and sometimes with pets and dogs and babies running around. So we're all in the same place in Beverly Hills at the Center for the Fibroid Treatment Collective. Let's just dive right in. We're talking about new techniques for taking care of fibroids, but Patsy and I have known each other probably longer than anybody else in the room. And Patsy, you had fibroids for quite a while. What type of surgery did you have for them?
I removed fibroids 5 different times.
Wow.
During my career. Every summer I was trying to make it till the summer break. And I spent every other year removing fibroids and spending the whole summer in bed 6 to 8 weeks and then going back to work. And it was just a constant battle.
Yeah, it is. That's a battle. And it's not just you. The fibroids aren't picking on you. Normally the fibroids, without a fibroid, the uterus is the size of my fist. And as the fibroids make it bigger, that muscle, just like it gets bigger with a baby, gets bigger and bigger. And if the fibroids are on the inside, it causes really heavy bleeding.
Right.
And my patients tell me that on my tombstone it's going to say fibroids are like ants, there's never just one. And that's the problem with a myomectomy. That's the surgery that you had, Patsy, is taking out the fibroids, sewing the uterus back together. Is there's little fibroids the size of my fingernail that will grow to be a big fibroid over time, because in 40% of women there is a environment that's going to create growth of these fibroids, and doesn't mean anything was done that was wrong. It just means that they will come back again. So myomectomy is a difficult procedure. Carrie, have you had any friends that have had myomectomies?
No, I have friends that have discussed it and talked about it, but haven't actually had that procedure.
Yeah. How about a hysterectomy for fibroids?
I've had friends and family. I had 2 aunts and my mom.
And people will say, I've got, my grandmother's had fibroids, my sister has had fibroids. Is it genetic? And in the black community, it's 50%, 1 out of 2 women will suffer from fibroids. The rest of the population, it's 40%. So it's an unusual family that doesn't have somebody with fibroids. And my mother had a hysterectomy, and I don't think she ever told me about why she'd had that until she started seeing some of this webinars. So yeah, what are the symptoms that bothered you the most? So you got the microphone, Carrie. So.
My symptoms that bothered me the most were the heavy bleeding and the bad cramps. The bleeding was heavy to where 1 sanitary napkin was not doable at all. And the cramps were bad enough not to get up and be able to walk.
Yeah.
Those probably were the worst too.
Yeah. And then the bleeding isn't confined to your menstrual period.
Sometimes it would be 3 weeks as a total cycle, because I would have a normal cycle plus bleeding afterwards.
Yeah. Julia, what about you? Were you suffering from the same thing?
I was suffering from intense pain and bleeding that was so bad I had to plan life around it. What I was going to wear, what activity I'd be able to do or not do. And yeah, getting out of bed, you feel like, am I sickly? No, I can't. I'm in so much pain. I can't move.
Yeah, I mean, and they call fibroids benign.
Right.
I mean,
right.
And you're never going to see a a marathon done for fibroids because they are benign, but it's really one of those have-not diseases that affects so many people that it's the same thing. Now, what about bladder pressure? Did you have that?
Yes. Didn't understand that that was related at all. Probably because I was more caught up in just the overall pain I would have. Just, the tears, the pain of and I couldn't. I'm an avid gym monkey. I love to go because it keeps me sane, and couldn't even do that, and that puts me in a mood. But more I could handle the pain. It's more the embarrassment. Is someone going to see what's happening? Even if I'm in these black yoga pants, what the heck's the embarrassment of someone seeing me like that.
So it's not just the uncertainty of not knowing when you're going to have an episode of heavy bleeding.
Right.
It's also affects your relationships. I mean, it's not tonight, dear. I'd like to make love, but I just no, it's not right.
Or you wake up in the morning and even if that man is your husband, you're still embarrassed. Look at what just happened. That's not normal, but you somehow keep plodding along as if it is.
Yeah, that's for sure. What about bladder pressure? Was that something that anybody?
I had the bladder pressure to where I wasn't sure what it was. I was thinking, is this bloating? What is this feeling? It was weird because I felt just really heavy, and I felt, I'll just go to the store, one of those markets, and buy something. But that didn't do anything. It was just that pressure of, did I put on 5 pounds? Now I can't wear this shirt. And there was a lot to it. And it was all at once. So I had the pressure, the heavy bleeding, and the cramps. And it was just, what is all this?
Yeah. Last month we had a airline pilot as a patient in here. And she said, they strap you in with a 4-way belt, and I was having to get out of that cockpit and into the restroom about every 20 minutes. It really gets to be a problem. And back pain. Anybody have back pain can you think back to the old days? Because, that uterus at this size, it's between the pubic bone and the hip girdle and the back, but as it gets bigger, it's got to press on the bladder, it's got to press on the back, and sometimes that back pain radiates down your legs. Yeah.
Yes. Or even I was driving once thinking, okay, I'll reach for the radio, and that hurt my back, and I felt so depressed. I felt like, what is going on? Like, what did I do? First, all the bladder pressure, all of this I didn't put together. But yes, just the reaching for something and going, oh, that hurt. And yeah, it's significant.
Yeah, and we were talking before we started our webinar tonight about what keeps you from getting help for those fibroids. And one of the things is the body is so used to adapting to difficult situations that it's sort of, this is normal. I mean, this is, if you could pass that mic back to Patsy, I want to, speaking of normal, I mean, tell us about the trip. Patsy's a band leader for the LAUSD, our school system here. And I remember the story about you were going to New Orleans, was it, with the band?
The day before I left, going to New Orleans with 2 buses of children, I started bleeding and looked like I couldn't stop. So I ended up going to emergency. They gave me a B12 shot, and they told me not to go. But the trip would have been off. So I got on the bus, and the kids took some sleeping bags and put on the floor. And I spent the majority of that trip on the floor of the bus going to New Orleans. When I got to Houston, where my sister lived, and being a teacher, I left the entire band with her to go to emergency to get another shot so I could go on to New Orleans. It was a horrible trip for me, but it was great for the children. Just bleeding profusely, it was embarrassing, and the kids understood that what I was going through. Everybody thought I was having a miscarriage, and it was just the fibroids.
Yeah.
It was a horrible trip for me, but the kids had a wonderful time. But just to go on a bus from here, 2,000 miles, on the floor of the bus
Yep.
was not a good trip.
Yep. And I don't know if any of you have had a blood transfusion for the
Yes.
fibroids.
I've had 8.
Yeah. Yeah. I
8 pints of blood. Well, maybe, I don't know if it's 8 pints of blood, but 8 times I went in for a blood transfusion.
Yeah.
And all behind the fibroid and the bleeding. It was so bad sometimes until I'll have on 2 or 3 pads and it's still coming down my leg. Sitting in the classroom, I had to send for a teacher once to come and take all the kids out so I could get up from my desk. So when I heard about you, you were an answered prayer for me.
Yeah. But now, so after 6 myomectomies, and you went back to your doctor. What was the prescription? What did they want to do for you?
3 different doctors, because I kept changing doctors because they kept telling me I definitely had to have a hysterectomy. And I was too young at the time, and I didn't want, not that I was going to have more kids, I didn't want anyone to take that privilege from me. After the 3rd doctor, I just felt like the rest of my life, this is what I have to live through, because I refused to go through a hysterectomy.
Yeah. And surprisingly, this was more than 20 years ago.
Yes.
But surprisingly, was anybody else offered embolization in this panel? Yeah.
No, I wasn't. I didn't even know about it.
No, I was thinking hysterectomy. No,
Oh,
not
hysterectomy.
embolization,
Yeah.
Yeah.
Not at all.
And Carrie, your procedure was 2 years ago?
It was 10 years.
10 years ago.
It's been about 10
Okay.
years.
Okay.
It's been a while.
And Juliet, yours was about 2.
Yeah, my procedure was about 2 years ago.
So, I mean, over the years, this procedure's been around for 25 years, but unfortunately, so many times, just it's not offered
No,
to women. So, how did you find out about the embolization?
I had been having the fibroid issues, offered the hysterectomy, or you could wait till menopause and see if that remedies itself. Hysterectomy was nothing I could even no way would I do that. I have children I'm raising. I'm not taking 6 weeks off. I don't want to be cut into for that. And so I thought, well, if I exercise harder, well, maybe that. I started to live with it as my new normal, but I would try something every month, thinking that I could fix this. I couldn't do it anymore when my son came home and I was on the floor crying and bleeding and could not contain myself to tell him, "Mommy's okay." And he called my husband saying there's something. It scared him to death. He thought something was extremely wrong with me, and I thought, enough. You can't. I could handle it, but not when it scares my child. And I called my OB and their office, and I was still in that hysteric mood, and they said we could see you in 2 weeks, and my mind was blown. So I got on the internet and started Googling and found you, and you saw me the next day.
Yeah.
And
You know, one of the things that we talk about, not necessarily sharing these problems with your significant other or your husband or your partner, but I've seen the opposite so much lately, especially since we do public service announcements on some of the local radio stations where it's the husband or the brother that calls up and said, "Hey, here's the number, go and get some information." So, and the other thing that is so obvious to me is these public information episodes that we put on are background music until you have the problem, and then it's not, oh, fibroids, blah blah blah. It's what was that number again? That's now you need to know the answers, and you need to know them quick, because it's
Well, we were saying that we're talking about it more, at least. Feels like because of that, and because I personally am willing to talk to my friends when I know they're going through it and just save them right now. Go straight in, and two of my friends have come to see you. It's like, what are you doing? Just really? I could do that? Yes. And it's changed the way I live life.
Yeah. Let's talk a little bit about embolization. Now, the people who are watching the webinar tonight, they can learn a lot more. In fact, see a procedure at fibroids.com. I got just on the way over here, I got a text message from a Jehovah's Witness saying, I'm worried this procedure is going to make me lose a lot of blood. And what I'm going to say is we get about a Jehovah's Witness every week because you don't lose a drop of blood in this procedure. In fact, it plugs the leaky radiator that's causing you to lose that blood. Several of the people who've had their 6 weeks off are a little bit incredulous when I say it's only going to be a 4-day recovery. Let's push this microphone back to Patsy. Do you remember what it was like going through your embolization?
I remember that I was in so much pain leading up to that. And I went home with the medication, just a mild pain pill, and I took it once. And that was it. Never took the rest.
Yeah.
And went back to work Monday. I just couldn't lift anything, but I had band practice and a parade to get ready for.
Yeah.
So I just walked the field rather than march the field and just never had problems again. And I couldn't believe I went from so much pain and medication to nothing. And for a long time, I kept medication to show people I wasn't on it anymore.
Yeah.
That I didn't need that in order to survive.
Yeah, you can give those extra large pads to somebody else now,
Tell me about it.
Yeah, for sure.
Oh, that was great.
But one of the things after that, I told everybody about it, and people looked at me funny about it. I said, I don't have that problem anymore. People who knew me and knew what I went through every year, I told them, I don't have that problem anymore. I can have a normal period. And I just had no more problems. 2.5 days, and it's over. I couldn't believe it. And I had stacks of pads. I took them to school to start giving them to some of the kids, keeping them in case they needed it. I didn't need that anymore. No more transfusion, no more pain. And to this day, I'm still telling people on my job, everywhere I go, I tell them about what happened to me. I didn't know these ladies, but everywhere I go and I see a lady going through that, I say, take this number, call this doctor, tell him I told you to call. Go see him and let him help you through a better life, because that's what he did for me over 20 years ago. And a lot of older women still sometimes don't say, well, I don't want to go through all that. It is the best freedom you can give to yourself.
And there are people, Patsy, who come into this office and we'll tell them about embolization, and they'll decide to go ahead and have a hysterectomy, and that's okay. Mm-hmm. I remember one of my patients saying, if you can't swim, you're going to drown. If you know your option, you can stay above water, and this is something you know about and you've decided not to do. Okay, but so many of the mothers who've brought people to the center where we've done these procedures have quietly said to me in the waiting room, I just wish this had been available to me when I was going through what my daughter's going through. And it is available. And Juliet was talking about the menopause. By the way, that doesn't work most of the time, waiting for the menopause. First of all, the years right before the menopause are probably the biggest growth spurt after pregnancy that a woman can have for fibroids. If you take any kind of estrogen in the menopause, fibroids are going to grow. None of this happens after embolization. It's without the blood supply, that's what we block. the fibroids shrink 50%. It takes about 6 months that you're not in pain for that period.
No.
But what was the you've got the microphone, Julia. What was the time that it took for your fibroids to shrink? We tell people 6 months, but some people, they go more shrinkage.
Well, Patsy made me think of that 4 days where we rested and went back to life, not lifting heavy things, etc. But I came back to see you. I would say it was less than 6 months, I believe, that I came back, and then I actually just went for an annual, and thankfully I can say that my doctor said, "Wow." And she said she had seen the ultrasound and said your fibroids. She unfortunately is the one that offered me the hysterectomy, and I said, I went to see Dr. McLucas.
You know, a lot of times this is part of education. It's not just educating your friends, but educating your doctor. And some people say, well, you know, shall I go back to my doctor? I said, please.
I did.
Go back and...
I didn't go angrily, but I certainly wanted her to know where I went. Amazing.
Yeah. I mean, this is important information to give to other health professionals. So I've got a couple questions that have come in here. This is a good one, and it's important. Is fibroid embolization, which we're talking about, covered by insurance? And the answer is yes. I mean, there's no public or private insurance that excludes this procedure. Now, when Patsy and I performed hers, it was still investigational, but that's long past. That's long past. So, and we have doctors within our group who take HMOs and people who take people on public insurance. So anybody who's listening who's got in any kind of coverage. Here's a question about what sort of anesthesia do you do for embolization? That's an interesting thing to see, because here's 3 people who've had it, but you were all asleep, so you don't know what it was like going through. But it's a big difference. Under general anesthesia, you have a tube down your throat, you have your reflexes are paralyzed, and the doctor's breathing for you. With embolization, you're breathing on your own. You don't know what's going on, and you don't feel anything, but it's your body's not in as much of a shock. So a lot of times, you know, people, and I've had sedation for colonoscopies and other things, you know, and all I can remember is talking to my gastroenterologist and starting a joke, and before I could get to the punchline, I was out. So wrong to do that. And, you know, and then, you know, I wake up and I said, so did you get the punchline? I went, no, not this time. Anyway, so it's a lot less of a problem for your body than is a general anesthetic. Here's a question from somebody in South America. Can birth control pills, do they help or hurt fibroids? Did any of you have hormones that your doctor prescribed?
I did years ago, and none of them worked. And they tried different types of birth control. Nothing worked at all.
Yeah. Yeah. Hormones can be prescribed to slow down heavy bleeding. It may, in some situations, slow down the growth of fibroids, but sometimes the side effects of these hormones, they can put you into an artificial menopause, and
Right.
it's pretty rough to take. So birth control pills can be a sort of a way station, but I don't think it's an answer in
They
the
made
end.
me crazy and didn't work.
Yeah. Let's see. What are the chances of having a baby after embolization? Well, I have to say here that there is some argument in my specialty in OBGYN, but the patients who were under the age of 40 that we've studied, half of them have had a full-term pregnancy, and that's the same statistics as somebody who's had a myomectomy. And half of those patients had a vaginal delivery, which you can't have after a myomectomy. So there is good news there for patients who are younger. What causes, here's a question from Russia. Vladdy, you're watching, you've got friends with fibroids. So what causes premature menopause after embolization? Well, back, we started doing this procedure in 1994. We started noticing in women who were late 40s that there was a higher percentage of people going into the menopause. It doesn't apply to anybody under the age of 45, just so that you can be sure of that. We think that the blood supply to the ovaries, which secrete estrogen, keeps the normal menstrual period going, are a lot more vulnerable as you get close to 50. So that's really that's what causes that. Let's see, does fibroid work all the time? It works 90% of the time. It works for 100% of the time for these three ladies here today. Yeah, but if you got a uterus that's this large, it's the size of a full-term pregnancy, and it shrinks to 50%, we're going to get you down to where most of you ladies were when you started. So I think there's a take-home lesson. Don't wait.
Right.
Don't, this is not the new normal. You can certainly plan on getting a lot of relief now and increase that chance of success. Well, we're getting to the end of our half an hour together. What about any thoughts that you'd like to share? Carrie, you've got the mic.
I would say don't be scared. It's okay. It's not normal. And it's a game changer to get this done. And it makes a big difference. So if you're having any type of issues or problems with fibroids, it's okay. We all have them, but it's not okay to accept it.
Yeah, you don't have to live with it.
Yeah.
Juliet?
Oh, I agree completely with her. And don't be embarrassed. You sit with 4 of your girlfriends at lunch, bring it up. I bet you at least 2 of them are going to have the same issue. And my biggest regret is waiting and thinking I was living the new normal, and that's just what's going to happen. And don't be scared. It's perfectly, because I was nervous coming in, and you calmed me down. And the procedure, just what we were saying, 4 days of rest, and took care, took it easy. But it was a game changer, absolute life changer. I wouldn't wait 1 second.
Good deal. Patsy?
Okay, mine was a little different. I was already going through hell, and I met this man who took me out of that hell. So much so, till 4 years ago, my daughter was going through it, and I flew her out here for the same procedure. And 4 days later, she flew back and never once complained. She came back for a checkup. Everything's fine. Not only have I done that, I'm looking at my 22-year-old granddaughter. She's had some minor issues, but I'm watching it. And when she gets a place where I can get her out here for a checkup, I don't want anyone to go through what I went through. If I can change one life, if I can just get you out there to understand what I went through and what a difference it made in my life, it gave me my life back. It gave me my daughter's life back. We don't have to do that anymore. You shouldn't have to live like that when there's a way to make your life better. And that would be my advice to anybody.
Well said.
Yeah, and I've got to tell you, ladies, that there's 2 very happy bits of news as far as I'm concerned. That most of our patients are coming from other patients. That's wonderful. And secondly, a lot of those doctors who have had a patient like Juliet, who've had the embolization, they become referral sources to get their patients this procedure. So I want to just say to everybody who's listening, thank you for attending. And panelists, thank you very much.
Thank you.
There is a survey that's going to go on right now, so I'm going to have our engineer start the survey and thank our audience out there and thank our panelists. So thank you very much, ladies. Thank you.